If you are over 60 and you take Losartan, Valsartan, Amlodipine, or Metoprolol, there is a very real chance you were told the name of the pill, the dose, maybe the time to take it, but not the part that actually decides whether you stay safe on it at home. And that missing part is where people get into trouble. They stand up too fast in the middle of the night and hit the floor before they understand what happened. They see ankle swelling and tell themselves it is probably just age. They get a stomach bug, keep taking everything exactly the same, and suddenly feel weak, dizzy, and scared to walk across the room. Or they stop a medication because they finally feel okay, only to learn the hard way that feeling okay was never permission to quit. I'm Dr. Clara Hoffman, and if one of these medicines is sitting in your pill organizer right now, stay with me, because by the end of this video, you are going to understand 11 truths about these medications that can help protect your heart, your kidneys, your balance, and in some cases, your life. And before we begin, subscribe to this channel for clear, practical health guidance designed to help you stay safer, steadier, and more informed at home. Now, let me say something important before we start counting down. When I say doctors won't tell you this, I do not mean your doctor is hiding something from you. I mean, most appointments are short. The explanation gets compressed. The basic instructions get covered, but the details that matter most in the bathroom at 2 a.m., in the middle of a heat wave, during a stomach bug, or while standing in the cold medicine aisle, those are often the details patients never hear clearly enough. And that matters because these are common medications, but common does not mean simple. Losartan and Valsartan are not the same as amlodipine. Amlodipine is not the same as metoprolol. They lower blood pressure in different ways, cause different side effects, and carry different warnings. The biggest mistake many people make is assuming they are all basically interchangeable, basically harmless, and basically fine as long as the blood pressure number looks better. That assumption is where people get hurt. So let's begin with truth number 11, because this one changes everything before the bottle is even opened. Truth number 11 is this: these are not 4 versions of the same pill. That sounds obvious until you hear how many people talk about them as if they are all doing the same job. I remember a man named Richard, 73, told me, "Honestly, doctor, blood pressure pills all feel the same to me." That sentence told me he did not really understand his treatment. Losartan and Valsartan are ARBs. They block a hormone system that tightens blood vessels and can also matter for kidney and heart protection. Amlodipine is a calcium channel blocker. It relaxes blood vessels in a different way. Metoprolol is a beta blocker. It slows the heart and reduces how hard it works. Same mission? Sometimes. Same method? Absolutely not. And when you do not know which road your medication is taking, you can misread everything that follows. You can misunderstand a side effect. You can panic over the wrong symptom. You can think your doctor changed your medicine for one reason when the real reason was entirely different. That is why the name of the pill matters less than the job the pill is doing in your body. And that brings us to truth number 10. Truth number 10 is that Losartan and Valsartan are relatives, not teammates. Let me tell you about Anita, 68, careful, organized, and absolutely convinced she was doing the right thing. She had been taking Losartan. After a hospital visit, Valsartan appeared on her discharge list. The bottles looked different. The names sounded different. So she assumed they must be different enough to take both until someone told her otherwise. Weeks later, she felt washed out, lightheaded, and weaker than usual. She thought she was just recovering slowly. But the problem was not slow recovery. The problem was confusion inside the same medication family. Losartan and Valsartan are both ARBs. That means one is not a little helper for the other. One is not a backup pill from an old bottle. One is not something to borrow from a spouse because you missed yesterday's dose. If a doctor switches you from one to the other, that change needs to be intentional and clear, because with these medicines, the family matters. They can affect blood pressure, kidney function, and potassium balance. So guessing is dangerous. Improvising is dangerous. Mixing old prescriptions with new ones is dangerous. And most people are never told that clearly enough. Now, truth number 9 is one of the most visible side effects on this entire list. Truth number 9 is that amlodipine can make your ankles and lower legs swell. And if nobody warns you first, that swelling can create panic. Margaret was 74 and still proud of how active she was. She walked every evening, stayed independent, and hated the idea of becoming someone who complains. Her amlodipine dose was increased, and within a couple of weeks, she noticed her socks leaving deep marks. Then her shoes felt tighter. By evening, her ankles looked puffy enough that she stood in front of the mirror, wondering if something serious was failing inside her body. Was it her heart? Her kidneys? Was this age catching up to her all at once? Here is what she had never been warned about. Ankle and leg swelling is one of the most common side effects of amlodipine. Now listen carefully because this point needs balance. Swelling on amlodipine does not automatically mean something catastrophic is happening, but it also should not be ignored, especially if it is new, getting worse, or happening with shortness of breath, chest discomfort, or rapid weight gain. That is the part patients deserve to hear from the beginning, because if nobody tells you swelling can happen, you may spend weeks trapped between panic and denial. You may stop walking. You may quietly worry. Or you may decide the medication is dangerous for everyone, when in reality the issue may be dose-related, manageable, or something your doctor needs to review. The hidden truth is simple. One of amlodipine's most noticeable side effects shows up where people can see it. And if no one tells you that, fear fills in the gaps, which leads to truth number 8. Truth number 8 is that metoprolol can make you feel older than you are, slower than you are, and colder than you expect, and many people never connect the dots. George was 76 and told me, "I think I'm just slowing down now. Maybe, but maybe not." He had started metoprolol after episodes of chest tightness and a fast heart rhythm. A few weeks later, he felt more tired in the morning, flatter in the afternoon, and annoyed that his hands felt cold even when the room was comfortable. He blamed age, he blamed sleep, he blamed winter, he blamed retirement, he blamed everything except the new medication. But metoprolol slows the heart and reduces its workload. That can be exactly why it helps some people so much. It can be useful for blood pressure, yes, but also for angina, heart failure, certain rhythm problems, and after a heart attack. The problem is not that metoprolol is a bad medicine. The problem is that patients are often never told what the trade-off can feel like in real life. Fatigue, lightheadedness, a lower internal engine, cold hands, less drive. And for people with diabetes, there is another layer. Metoprolol can blunt some of the warning signs of low blood sugar, especially the pounding or racing heartbeat some people rely on as an alarm. So if you start feeling unusually tired, mentally flat, weak, or slow, do not just file it under, "Well, I'm getting older." Maybe you are, but maybe your medication is trying to tell a story that needs to be reviewed. Now, truth number 7 is where everyday life becomes dangerous very quickly. Truth number 7 is that the riskiest days are often not years later. They are the first few days after starting a medicine, increasing the dose, combining it with something new, or restarting it after being inconsistent. Helen was 81. Her Valsartan dose was raised after several high readings. She took the higher dose that evening, went to bed, woke up in the dark to use the bathroom, stood up too quickly, and found herself on the floor before she fully understood she had become dizzy. This is what people do not picture when they hear the phrase blood pressure medicine. They picture stroke prevention in the future. They do not picture the hallway tonight. They do not picture the throw rug. They do not picture standing in the dark with an older body that does not adjust as fast as it once did. That is where the real-life danger lives. Because dizziness is not just a symptom. For an older adult, dizziness can become a fall, and a fall can become a fracture, a hospitalization, or a loss of independence. So when a dose changes, you need a strategy. Sit before you stand. Pause at the edge of the bed. Turn on the light. Move slowly. Pay attention to lightheadedness instead of pushing through it like it means nothing. Patients are warned about what might happen in 10 years if blood pressure stays high. Too few are warned about what might happen in the next 10 hours if their body is still adjusting. And that takes us to truth number 6. Truth number 6 is that dehydration changes the whole equation. Frank, 70, got what he thought was just a simple stomach bug, a day of vomiting, a day of diarrhea, poor appetite, hardly drinking. But he kept taking his Losartan exactly as usual because he thought being disciplined meant never missing a dose no matter what. By the second day, he felt terrible, weak, dizzy, unsteady. The medication had not suddenly become bad. The body around the medication had changed. This is one of the most overlooked truths about blood pressure medication. The label says, take daily. Real life says sometimes your body is not your normal body. When you are vomiting, having severe diarrhea, barely eating, sweating heavily in extreme heat, or not drinking enough, blood pressure medications can hit differently. With Losartan and Valsartan especially, dehydration can make people feel faint, washed out, and frighteningly unwell. That is why every patient on these medications needs what I call a sick day conversation. Not random stopping, not guessing, not internet advice from strangers. A plan. What should you do if you cannot keep fluids down? What should you do if you are sick all day? What should you do if your pressure suddenly feels too low and you are afraid to stand? Those questions should be answered before you are sick, not while you are sitting on the bathroom floor too weak to think clearly. The hidden truth is this: take it every day sounds simple until illness, heat, or dehydration changes the rules. Now, truth number 5 is where a lot of careful people get blindsided. Truth number 5 is that over-the-counter products can quietly interfere with your prescription. Linda was 72 and extremely faithful with her medication routine. Then winter arrived with sore knees and a miserable head cold. She reached for an over-the-counter pain reliever and a cold medicine from the pharmacy shelf, never thinking those choices had anything to do with her blood pressure pills. A week later, things felt off. Her readings were worse. She felt more swollen. She thought her prescription had suddenly stopped working. But often the prescription is not the only player in the story. Painkillers like ibuprofen or naproxen can matter here, especially alongside Losartan or Valsartan. Some cold medicines, especially decongestant-containing products, can push blood pressure in the wrong direction. And then there are supplements, herbal products, and natural remedies that patients assume are automatically safe because they were not prescribed. That assumption is expensive because your prescription does not live alone. It lives inside an ecosystem. Every pill, powder, capsule, and cold remedy you add becomes part of the same conversation inside your body. So if your pressure suddenly rises or you feel different, do not only stare at the prescription bottle, ask what else entered the picture. That question saves people from blaming the wrong thing. And now we move to truth number 4, one of the most quietly dangerous traps for people on Losartan or Valsartan. Truth number 4 is that potassium can become a hidden problem, and one of the most innocent-looking sources is often the salt substitute on your kitchen table. Barbara, 67, was told to reduce sodium. She took that advice seriously. She stopped salting food and switched to a heart-friendly salt substitute. She felt proud of herself every time she used it. What she did not know was that many salt substitutes contain potassium instead of sodium, and that matters because Losartan and Valsartan can affect potassium levels. Now, add kidney issues, dehydration, certain other medications, or potassium supplements, and suddenly something that looked healthy on the label may not be harmless in your body. This is one of the cruelest medication traps because it catches people who are trying to do the right thing. They are not ignoring advice. They are following it without the missing warning. So hear me clearly. If you take Losartan or Valsartan, do not assume salt substitutes are automatically safe. Do not assume potassium supplements belong in your routine just because they are sold next to vitamins. Do not assume weakness, odd palpitations, tingling, or muscle symptoms should simply be brushed aside. There is a reason doctors sometimes monitor kidney function and potassium on these medications. They are not being fussy. They are watching the part most patients cannot see, and that leads us to truth number 3. Truth number 3 is that needing 2 or even 3 blood pressure medications does not mean you failed. Thomas was 71 and looked almost embarrassed when he admitted he was now taking more than one medication for blood pressure. He spoke as if it were a moral verdict. "I guess I really messed up," he said. That belief is common and it hurts people. Because high blood pressure often does not respond best to a single medicine pushed higher and higher. Sometimes it responds better to a strategy. One medication may relax blood vessels, another may block a hormone pathway, another may slow the heart or address a separate heart issue. Used thoughtfully together, those medications are not proof that your body is broken. They are proof that blood pressure can have more than one driver. The emotional danger here is shame. Shame makes patients hide missed doses. Shame makes them resent a treatment plan. Shame makes them treat combination therapy like a punishment instead of a strategy. If you are on 2 medications, that is not a confession. If you are on 3, that is not evidence that you ruined your health. The better question is not, why am I on so many pills? The better question is, do I understand why each one is here? And that question becomes even more important in truth number 2. Truth number 2 is that metoprolol is often not prescribed only because your blood pressure is high. Edward was 69 and frustrated because he had read online that beta blockers were not always the first choice for simple high blood pressure. He looked at his medication list and decided he must have been treated incorrectly. But he had forgotten the bigger picture. Years earlier, he had episodes of a racing heartbeat and chest discomfort. In his case, metoprolol was not just about lowering a pressure number. It was also about slowing the heart, reducing workload, and helping control symptoms that mattered every bit as much as the blood pressure reading. This is why headline medicine advice can confuse people. Losartan, Valsartan, Amlodipine, and metoprolol are not competing in some contest for the best blood pressure pill. They are answering different questions in different bodies. So if you take metoprolol, do not make the mistake of hearing that it is not always first line for plain hypertension and then deciding it must not belong in your life. Ask the real question, why was it chosen for you? Fast pulse, angina, a prior heart attack, heart failure, rhythm symptoms? Something your heart needed beyond simple pressure lowering. The hidden truth is not that metoprolol is wrong for everyone. The hidden truth is that many patients were never told its specific job, and once you miss the job, it becomes very easy to make the most dangerous mistake of all. Which brings us to truth number 1. Truth number 1 is this: feeling better is not permission to stop these medications on your own. And with metoprolol especially, stop suddenly can be dangerous. I still think about a man named Daniel, 75, who had grown tired of taking so many tablets. One week, he felt especially worn out at his metoprolol and decided to take a break for a few days. No phone call, no taper, no discussion. By the second day, his heart was pounding. He felt chest pressure. He ended up in the emergency room, frightened and confused. That is the part too many people never hear clearly enough. Some medications do not just lower a number quietly in the background. They become part of the rhythm your body has adapted to. Pull them away suddenly and the rebound can be harsh. And even beyond metoprolol, this mindset is dangerous. Losartan, Valsartan, and Amlodipine are long-term control medications. High blood pressure is often silent. It does not tap you on the shoulder every morning to remind you it is there. So when a patient says, "I feel normal, maybe I do not need this anymore," they are misunderstanding the victory. You may feel normal because the treatment is working. That is why freestyle dosing is so dangerous. Skipping while traveling, doubling the next day, taking it only when the machine shows a bad number, stopping for a week to cleanse the body, restarting when you feel guilty, that is not control, that is chaos. And blood pressure medication does not protect you when you treat it like a mood. It protects you when you treat it like a system. So let me bring this all together the way I wish every patient heard it on day 1. If you take Losartan or Valsartan, understand that hydration, kidney monitoring, potassium, and even salt substitutes can matter more than you think. If you take Amlodipine, know that ankle swelling, dizziness, flushing, and fatigue are not things to silently suffer through without a conversation. If you take metoprolol, understand that tiredness, cold hands, a slower pulse, and even blunted low blood sugar warning signs can be part of the picture, and do not ever stop it suddenly without medical guidance. If your dose changes, be more careful getting up, especially at night. If you become sick with vomiting, diarrhea, or poor intake, know that your medication plan may need review. If you buy pain relievers, cold medicines, supplements, or salt substitutes, do not assume they are harmless side characters. Sometimes they change the story. And above all, ask one question every patient deserves to ask. What exact job is this medicine doing in my body? That one question changes everything because it turns blind obedience into informed safety. And I want to leave you with this. Somewhere tonight, an older adult is opening a pill organizer and swallowing a tablet they do not fully understand. Maybe it is Losartan, maybe Valsartan, maybe Amlodipine, maybe Metoprolol. Maybe they have taken it for years and still could not clearly tell you why it was chosen, what side effect matters, what symptoms should prompt a call, or what should never be mixed casually beside it. That is not a personal failure. But after this video, it does not have to stay that way. You do not need to become a cardiologist overnight. You just need to stop being a stranger to your own medication. Know the family, know the purpose, know the side effects that matter, know what changes when you are sick, know what should not be mixed casually. Know what should never be stopped suddenly. Because when you understand your treatment, fear goes down, safety goes up, and you stop being the person who just swallows a pill and hopes for the best. You become the person who understands what is protecting you. Take care of yourself. Protect that heart.